Hey guys, all right, we're gonna get started here soon. But how was y'all's last weekend? What is today? Wednesday. So how was y'all's last weekend?
My weekend was good. I spent a lot of time on the beach and lots of interesting things going on. We had a whole entertaining day on the beach last weekend. So lots of new boats coming through. It's kind of fun to watch, and the ocean was really active. It's a lot of really big waves, and I'm not sure what that was all about, but it was kind of a relaxing weekend. And anytime on the beach is a good weekend. How
Yeah, it's
about
been
you?
too long. It's been
Yeah.
too long for me.
Oh, you ought to come and visit.
I need to. I
Yeah,
need to for
yeah,
sure. I'm trying to plan the kids to go to Disney next summer. So that's
yeah.
my goal.
Only 3 hours away. Yeah, yeah,
Well,
yeah,
we'll make sure, and I got more time. I'll come before. But
yeah,
Jim, you have a good weekend.
It rained all weekend here in Annapolis,
yeah.
Maryland. So
Oh,
I was in the office a good part of the weekend trying to get caught up from nothing that gets accomplished during the week.
Yeah,
sure.
yeah, yeah.
Absolutely.
Isn't that the truth? I don't know where the time goes. It just kind of flies by. And here we are at Wednesday already. It just feels like we were working on Friday.
Yeah.
And now we're halfway through the week already. It's amazing how time flies. Yeah.
Yes, it is. Yes, it is. We are coming up into Q4. Um, right, what, in 5 days?
Yeah.
October 1st.
Value-based
Beginning of
purchasing
the
last quarter. Yeah. Yeah.
beginning of the hospice fiscal year. Whoop
Yeah.
whoop.
That's right.
All right. 12:03, time for OTC. Hey everybody, John Kublake here, and welcome to another episode of Off the Cuff, All Things Healthcare. I'm so excited because I get to grace this stage with one of the most intelligent, dynamic, and all-around best human beings on the planet, Miss Arlene Maxim. Arlene, how are you?
I'm good. I'm good. You always make me feel so good. Thank you so much.
Oh,
Makes my day, makes my week. Thank
oh,
you so much.
wonderful.
Yeah. Yeah.
Tell us who we have on our show today, Miss Arlene.
Well, we have invited Jim Bland, who actually senior home services, with an entire suite of solutions on some answers for the scathing OIG report that came out a couple weeks ago. That we're going to talk a little bit about. But before we do that, and before I formally introduce Jim, I would like to hear about your exciting venture. I heard
Yes, thank
through the
you. I know.
grapevine, a little birdie told me that you had a publishing thing going on there, and
Yeah.
we are excited to hear about
So, been working on a new book for children's book. I call it an experience book, but it's a coloring book, and it's called Frankie Finds Forever: a Journey of Love. So this
that.
is going to be a free download, and again, it has a coloring book aspect to it. For patients and a young child, maybe 3 to 7. I mean, it can be anybody. We all love to color, but to spend time with their loved ones. So we're getting it all together. We should have a website go live and a free download on October 1st, but it should frankiefindsforever.com. But
So it's a coloring book about children who are at risk of losing something they love, not necessarily a person, perhaps a
no,
pet, perhaps their parents are going through a divorce,
yeah.
any kind of loss or grief or anything. So that's the plan for working through that coloring book, correct?
Yeah, and I tried to keep it very high level with that purpose in mind, just because I wanted the parent or the guardian to be able to utilize this book as a tool to talk about something potentially extremely difficult with a child that hopefully has never gone through anything like this before.
Right.
And me as a parent in hospice and in home care, having lost people myself, having to explain that to your kids. There's just not a lot of tools out there that give us as parents and guardians that opportunity. So I've been working on it for the past about 6 months. I've had the idea for several years. but it's finally coming to fruition. So yeah, a few days away. I'm tightening up the last minute stuff, and then hopefully we're going to send it to. It'll be available for purchase for paperback through Amazon here, hopefully by November 1st as well. So.
Well, I'm
Very
proud
excited.
of you. That's a great undertaking, and
Thank
I was able to just briefly look at some of the graphics, and you've got a great graphic designer that's put life into the book.
Illustrator is Andrea from the Ukraine, so she did an amazing job. We worked well together, so I was really excited. So, and I have a Facebook page, and so we'll be sharing some of that stuff on our Facebook page as we come out. So we hope y'all get an opportunity to take a look, download it. Hope you get to utilize it. Very excited about it. Thank you, Arlene, for letting me share it. I appreciate it.
Sure, absolutely. Yeah.
But yes, let's get started. We got 3 people on there, and I'm going to be watching the comments, guys. Please feel free before we get started to send some comments through Facebook and LinkedIn. I should be able to see it on my screen, and we'll be able to share it to Jim and Arlene and to the rest of our audience. So, Arlene, please.
Yeah. So on September 5th, the OIG came out with a report that was completely unexpected as far as I was concerned, and I didn't know many experts that knew it was coming out, regarding the reporting of falls on behalf of the home care agency. And what the OIG basically said was that not only were we not reporting them, sometimes we were not even home health care. Sometimes the OASIS submission was not even done at discharge and transfer. There are a lot of reasons for that. It's not just that they neglected to do the transfer. Some of the reasons for that is, number one, they may not have known that the patient was in the hospital. Number two, the patient may never have come back to that agency, particularly with a fracture. Oftentimes they go to rehab and the agency never sees that patient again, or may never see that patient again. Not that they can't, but they may never. So there are reasons, and we're not going to talk about that so much. But what I wanted to do was talk a little bit about what we can do as an industry to make this story end better than it looks like it's ending now. Because one of the things that OIG did was make recommendations to CMS to start watching our OASIS items more closely, and the way we're answering those items more closely. With that, you're going to find, I believe, in our industry, in the home health care industry, we're going to find that surveyors are going to be really looking at how we answer the OASIS questions and how we're identifying risk. There are over 130 items in OASIS, and over 80% of those items that we are assessing have something to do with fall risk. A lot of those are functional. Some of those are hearing. Some of those have to do with health literacy. Health literacy impacts that patient's risk for falling. We don't think about that. So in the conditions of participation in 2018, when they were updated, the conditions say that if we identify a hospital risk, and by the way, risk for hospitalization and emergency room visits should be something we're really, really, really honing in on, because 35% of value-based purchases based on how often our patients go back to the emergency room and go into the hospital. So what the condition said was that if we identify a risk of any kind for hospitalization or emergency room visits, we have to have a plan for that. So in our plan of care, we must identify a specific plan for that patient and what we're going to do to eliminate that risk or reduce that risk. Well, what we do now, from what I look at hundreds of records like on an ongoing basis. What we do now is we order PT, we order OT, we remove rugs. We tell the family to remove cords when they're a trip hazard or something like that. We don't really dig into the specific things like hearing, like health literacy, like not understanding what they're supposed to be doing, not understanding their diagnosis. Patients like with MS, with Parkinson's disease, of course, those types of diagnoses, Parkinson's in particular, have a very, very high risk of falls, and those falls occur all the time. So injury as a result of those falls is very common. So what I wanted to do today is bring Jim Bland in, because Jim Bland, like I said, has an entire, in his company, Senior Home Services, has an entire suite of solutions for fall risk. And these are specific solutions that we can actually put on our plan of care, place on our plan of care, and we can follow through. Some of them have to do with technology. And anybody that's heard me speak in the last couple of years know that I am a huge fan of technology. I mean, we don't, with the staffing shortages we have now, with the way with the cuts in reimbursement we have coming up, and that we are impacted by even now. There's so many reasons that we have to start leaning on technology. We cannot be seeing people 3 times a week any longer. I was talking to one of my colleagues last week. We're talking about front-loading visits. That front-loading visits has been a plan that many home care agencies have had in the back of their mind, and they actually put it on their plan of care for reducing the risk of rehospitalization, which means that you're going out there almost every day. Somebody is going out there almost every day, whether it be a therapist, an aide, or a nurse, and physically seeing that patient. That's not absolutely necessary. We have remote care monitoring that Jim can address a little bit. We have other technology that can really help us elevate our industry to where it needs to be. And the technology is one of those things that are going to help us do that. And so getting connected with the technology that's important is going to be very helpful, and having these patients understand. We can't keep doing, there's a term that people use all the time, and you ask them why they do something, they say to me, and I hear this probably weekly, well, that's the way we've always done it. And we've got to get rid of that verbiage. That's got to go away. We can't do things the way we've always done them. We have to change. So putting technology in a home and reducing the risk for falls is so important. And we can see reducing the number of actual physical visits we do and increasing the amount of technology that we use is going to allow us to see more patients. And that's what we need to do. Staffing shortages are forcing us to see more patients. We can't see more patients in a day or in a week and expect to get our documentation in on time. Point of care documentation is so very important, making sure that you're looking at that patient, assessing that patient where they are at the time you're there. And so there's all kinds of other things that are included in here. But what I want to do is talk to Jim about what he sees and some of the statistics that he's been able to uncover as far as fall risk, and what kind of solutions are available out there with the use of technology, and how home care companies and even hospice, St. Croix Hospice did a piece on LinkedIn yesterday about falls in the home with hospice patients. So even hospice patients, and those patients aren't necessarily the ones you have on for long term, but they still are at risk for falls and rehospitalizations, which impacts on the reimbursement for hospice. So it impacts their GIP and all kinds of different things. So
and I think on the hospice too, just real quick, I think it also, obviously would affect the mortality rates at the hospital too, and falling, going back to the hospital on hospice is no go. And before Jim gets started, we have a lot of people here. I just wanted to recap real quick. The OIG with their report came out. Key findings that we're going to be talking about with Jim Bland is that there was an underreporting of falls. Around 55% of the falls identified in Medicare claims were not reported. Demographic discrepancies were underreported among younger individuals and among Black, Hispanic, and Asian. For-profit versus not-for-profit reporting differences, inconsistency with data, and missing data from those hospitalization patients. So, Jim, how do we address some of these issues?
Well, it's easy. What I think I'd like to do, John, may I share my screen, and I'll almost walk us through a couple slides on what we see in the landscape out there today. And in Seniors Home Services, we're really a healthcare technology firm, providing technologies into the home that can be used by seniors and caregivers that are going to prevent falls improve people's lives, and most importantly, keep them out of the hospital. But what we do know, just last week, CMS published this, stating that the number one cause of ER visits today are unintentional falls that are occurring in homes. And that's a real problem that has ended up landing people in the hospital one after another taking place. Now, what we also know is that it's preventable. And when we look at what causes falls, medication non-adherence, people simply not taking their medications when they should be taking them, and somebody not knowing that that's going on. Unsafe homes, lack of grab bars, stairs that are not done configured correctly, poor lighting, inadequate bathrooms, people trying to climb over, a climb-in tub with no grab bars in place, and not having proper equipment, nighttime wandering, getting up at 2:00 in the morning when they're unstable anyway, wandering through the house down a flight of steps with it being dark, people having poor balance, poor cognition, that in and of itself, it really is problematic. And hearing loss, a lot of people don't realize having, any type of hearing issues can increase the rate of a fall by about 300%. And then, of course, poor vision. Well, all of these are absolutely preventable in doing that. And what we provide are solutions to be able to do that. We have some really neat cognition improvement technology programs that seniors can go through right in their home, right on a tablet or on a smartphone. We've got some really neat equipment that will go into a home. No cameras, no listening devices, no wires, no anything. That's going to let a family know, what's going on at night. Do we have somebody who's wandering, or those type of activities? Do we have too many trips to the bathroom, which we know can lead to a UTI, which leads to dizziness, delirium, and those type of things that cause falls. Hearing aids. Hearing aids can normally cost anywhere between $3,000 to $5,000. We have them for medical grade for several hundreds of dollars. And then medication adherence, being able to know if somebody is taking their medications, when they're supposed to be taking them, in doing that. And we have the ability to do that. And then and home modifications, being able to make those simple modifications in a home that can have a huge difference as far as somebody being able to be safe at home. So what we're able to do, we encapsulate everything we do into an application that goes onto someone's tablet or smartphone. And this is such a neat program. It's what's built into it is a video chat. Simply by somebody tapping here, they can have a video chat with whomever. So, if someone's having issues at home and they want to talk to somebody about what's going on, they just boom, tap, and they can all automatically let them know. Our exercise programs are built in there, such as Zing Performance, Brain Savers, brain workout programs, balance building. So these are all fun things that somebody can do by watching it right on their screen. The videos play and walk them through it, what to do and how to do it. Medication adherence monitoring. So this basically comes on, it tells somebody it's time to take 2 XYZ pills, time to take 2 XYZ pills. And it will do that until someone taps the button and says, yes, I either took my pills or I didn't take them. And here's why, when they have a little drop down that comes down. Has on-demand education, a lot of things as far as, going ahead and informing people, what they can do to make sure that they're not going to fall, how they can prevent those from taking place. And then we reward them. We have a rewards program. If somebody is doing their exercises, they're being compliant with medications and those type of things, they build points and they get a gift card every month. And this is all free. This is paid for through our reimbursements, and we give them access to their Facebook page, their weather, news, games, nutrition, and the family can also have access remotely to be able to look in and see how mom or dad or brother or sister are doing with their exercises, with their questions sets, as far as how they're feeling. What we try to do is to make sure someone's not getting depressed, lonely, isolated. People don't realize that has a huge effect on, it can increase the onset of dementia and Alzheimer's by 500%.
Yeah.
And that is something else that then will end up leading to falls. So, all these things, it's all about just being as healthy as you can be. And we actually, we provide this. Doesn't cost the patient anything, or the client, doesn't cost the family anything, and incorporates all of these into it. I will tell you, if somebody is using this system, they are going to stay out of the hospital. They're not going to have falls. And we have local representatives that will come right to the home, help somebody have it installed right on their phone or right on their tablet. If they don't have a phone or a tablet, we have resources to be able to get those for somebody and have it paid for as well. So, we're really excited about that. And the last thing we do, we give people a free guide. It's called Stay in Your Home. And this is all about being able to have someone be able to stay in their home, knowing what to do to make that home as safe as possible, and where there are individual resources, state by state, for them that nonprofits and different community associations and states that will actually help families financially be able to stay in their homes. Because we've got the silver tsunami taking place, and it's coming, and we don't have enough places for people to go, and people don't want to go anywhere. They want to stay in their homes. So Arlene, John, this is a great way that we can help prevent falls, keep people healthy in their homes, and keep them out of the hospital.
Jim, you have a certification. You have a CAP certification. Can you explain to us what that means? And from my understanding, the folks that would be going into the home, or a lot of those folks, also have that CAP certification, correct?
Well, yeah, we are. I carry what's called a Certified Aging in Place Specialist designation. Been through extensive training through the National Association of Home Builders with a specific program that's all geared towards how do you make sure a home is accessibility and safe for someone to be able to age in place. Mm-hmm. Our representatives that we have throughout the United States that work with home healthcare agencies, physicians, home care companies, in doing that, they go through extensive training with us. I mean, they'll be in training for a couple weeks before they're actually out working with an agency, and then going into to meet with a patient to help onboard them onto our platform, our health platform, and then they'll spend time with them in the home, just making suggestions on what should be done. The other thing we do along with that, we've got a relationship with the largest national home accessibility contractor community. So these are contractors who only focus on making homes safe for people to be able to stay there, and make them fall resistant and being able to stay there. They'll come out and do a free assessment. They'll come out with a trained person, do an assessment, provide ideas as to some minor things with railings and grab bars, and a couple things that should be done that are going to prevent falls, and what it would cost and how it can be paid for.
So a couple of things that I'm hearing, and thank you for all of that. I think there's a lot that is exactly what the OIG is trying to get. And going back to what Arlene said earlier, we have to start adapting a mindset of what are the tools, technology tools, whatever tools are available that can help our patient population get us to our goal with value-based purchasing and this sort of stuff coming up. But the OIG had said some of the ways that they could counteract this fall issue, this fall report, increase or expanding our data sources. Exactly what you're saying. When you have these seniors that are now interacting with integrated yet different apps, like the Brain app, this app, those sort of things. Now we're getting an expanded data source. Now we're starting to see across a greater scale. And we used to think, X, Y, and Z were the only pieces of data that mattered. But when you look at the macro and you start collecting and we have the ability to collect at scale these large databases of, thousands and thousands of data points, then Netflix suggestions probably could actually make a big difference when you start to see, to your point earlier, that it probably connects to social determinants of care, right? Because what you're watching, you're like, why are they only watching sad stuff? Maybe we need to do something, or they're not interacting as much. Maybe they're depressed. But it sounds like a lot of what you're doing is exactly going to, trying to help with this fall. But I think my gut is falls is just one variable, one issue. But you could probably say it across all of them, that this is a rampant issue, that things are underreported in all areas, or we could do better in all areas.
Well, I think we have a moral and ethical responsibility to do that. I mean, we have a job. Medicare has given us a tool, a data collection tool, OASIS E, and we have a responsibility to get the best information possible about that patient up front, keep them out of the hospital. That's the intent of home health care. These people don't want to go in the hospital. There are 440,000 people a year. Think about that. And you can look it up on the internet. This is a true number. 440,000 people a year who die in the hospital as a result of medical mistakes, infections, and all kinds of other things. And we have to keep these people out of there if we possibly can. And not only that, we have to improve outcomes. So when Jim is talking about all these tools and the technology that's accessible, we need to think about, as an industry, we need to think about, well, what can we do? We can't just put in PT, OT, and that's fine. I not that they don't need that any longer, but now we have to do something. We have to change their lives for the better, not just go in there and put up a home exercise program and trust that they do it, because many times that doesn't happen. We have to actually be proactive and get things in there, such as the tools that Jim has to offer, to make a difference in the lives that they're living. He talked about the tablet that you're talking about, and the interactiveness. That's what keeps people's minds sharp. And nobody wants to get dementia. I think I read a statistic recently where the number one fear for people getting older is not cancer anymore, it's getting dementia. And and that loneliness right now in the United States is an epidemic. Certainly COVID pushed it to limits that we never thought it would go to. But loneliness is an epidemic, and getting these people's mind active and getting them interactive on those tablets, I suspect they can even visit with their families somehow. There's probably a connection you can put on there that they can do something.
Arlene, that's the video chat. All they do is they tap the face of one of their family members. Boom, video chat opens right up. I will show you a little example right here. So somebody's in here. Their photo of their loved one is right here. They can tap on it, and now they are doing a video chat with them.
Now, what's the expense to an agency for this, Jim?
Zero expense to an agency, zero expense to a patient and a family.
Yeah. Okay. And then how does that work? How do we get involved in your program so that we can reduce falls, we can reduce rehospitalization, we can reduce emergency room visits? What can we do? How do they contact?
And we have to note that CMS, just for all of our listeners, because I want to make sure that we're tying this back. CMS agreed with everything that the OIG said. So it's not like we should be surprised if and when penalties start coming down heavily for this, because like you said, it was unexpected in a lot of ways. So that's unexpected. Penalties should be expected.
New one.
My alert just went off for a medication reminder.
One.
Oh.
New one.
So now I'm going to tell it, yes, I'm taking my meds. That was a typical example of a medication reminder going off.
Okay.
But John, I didn't mean to interrupt you. This was not planned. It was preset.
No, it's good. It's good.
But it's so easy to work with us. I mean, Arlene, to answer your question, and that is our toll-free number is 800-480-3344. And we have representatives throughout the United States that would welcome the opportunity to schedule a
what was
meeting
that number
with you.
again?
800 480-3344. And we have representatives throughout the United States that would be happy to come out, meet with your agency, walk through our solutions, show you how easy it is. And all an agency needs to do is say, when they're meeting with the patient, is to be able to have, we give them a nice little video and a sample to use of our program, and to be able to have the patient say, you know what, that makes a lot of sense to have that included in my plan of care to help me prevent falls, to stay out of the hospital, to improve my functionality, reduce readmissions, be happier. And our representative will come right into the home, get them onboarded, and we will take care of it from there.
Awesome.
So now I remember you mentioning on another conversation about something new that you have. One of the top diagnoses for forcing people into the hospital is congestive heart failure. And I know that home care agencies in particular, and also hospice, have a fair number of congestive heart failure patients. What do you have available for those types of patients and agencies who see a number of those? Because, you know, it's not only costly for a hospital, but it's also costly for a home care agency to have those on their census. The condition of those patients can turn on a dime. It doesn't take much for them to exacerbate in their condition. So what do you have available that could help them also stay out of the hospital with that particular diagnosis?
Well, you know, Arlene, with heart failure patients are the most expensive for CMS, the most difficult ones for physicians to manage. And what people don't realize is that 83% of heart failure patients are not managed by a cardiologist. They're actually managed by a GP. Well, if they do have information coming in, it's information overload that there's so many things changing so quickly in those patients. The physicians in many cases go, oh my gosh, get to the ER, get to a cardiologist,
Exactly.
when in fact, you didn't need to do that. So our system is called Pulsario, and Pulsario is a unique AI-driven software platform that utilizes the standard peripheral equipment in the home of scale, blood pressure cuff, glucometer, pulse oximeter, and data is automatically coming into the CardioStein software program, which is data fed through research, which is data fed through literature, is data fed through all different types of outcomes and recommendations from drug manufacturers, so on and so forth. And the software manages the patient. It actually tells the physician, here's what's really going on with this patient. We need to up this med, down this med, get rid of this med, bring in this new one in, because the medications need to change very rapidly with a lot of these patients. The average industry 30-day readmit rate for a CHF class 3, class 4 patient is 24.7%. Pulsario has documentation of being less than 1%. The average 60-day readmission for a CHF class 3 or class 4 is 33% to 38%, depending on region. Pulsario is coming in at 6.1%. So when we're looking at those type of reductions in readmission rates, it is huge for a home care agency. It is huge for the physician community, and CMS. It's saving them a ton of money. We're working with.
This is covered, so there's no charge to there's no charge to the family or to the patient family or to the agency for using this.
No, this is reimbursable. CMS wants to keep these patients out of the hospital. You know, CMS has 4 goals in mind when you're looking at doing that. Number one, they want to keep them out of the ER. They want to keep them from being admitted to the hospital. They want to keep them out of a nursing home, and they want to prevent unnecessary referral to specialists that we don't have. Pulsario does all 4 of those, and it's just a tremendous tool. And then when we combine that with our health tablet platform, my gosh, it is utopia for all involved as far as being able to improve someone's quality of life and keep them out of the hospital.
And this is another thing that could be added to the care plan when you admit a patient with congestive heart failure. with the blessing of the primary physician who signed the certification statement. But it could easily be added as long as the physician understands what this is all about, correct?
It does. And the beauty of it for a healthcare agency is when they're meeting with our representatives, they'll be able to go through exactly how this process works, and will show the agency how they can communicate this to their primaries that they're working with, and make an introduction to us so the primary knows that this solution is available to them, and everybody wins.
And it opens up another market for the home care agency. I mean, we're always trying to find ways to, John, you know this, we're always trying to change ways to change our market and the types of admissions we're getting. So this could be certainly a wonderful way to expand the types of referrals that we're getting in and actually make a difference in people's lives.
Well, and I think last week when we were talking about how we should really start looking at home care as encompassing home health, hospice all together, it's really important that predictive analytics and these tools are used so that we understand the right levels of care. And so we can, make sure that we're keeping people out of the hospital for falls, heart, whatever it might be. I'm always preaching on social determinants just because I think it's highly undervalued. Nobody really spends a whole lot of time because we haven't really got a grips on the clinical or physical side yet. But, these predictive analytics are so important, but we don't trust them because they don't take our gut. And I think this is one thing that we're going to have to peel away. I'm reading Daniel Kahneman's new book, Noise, highly suggested, out there for everybody. I haven't finished it in like 3/4, but very good. You've named the industry, and this is outside of healthcare, but doctors included. There is noise. There is clear error that is always happening, and there is bad variables that have to be sifted through that our ability as humans can't do that. And we need to start trusting tools as a help to sift through that noise and give us at least 2 or 3, if not hopefully one really good option that's actionable, right? And I think that's what we're talking about, is that we're starting to see that we don't really have much of a choice, because as our population ages, as these problems happen, as we become more independent living, which we don't have our communities taking care of each other. We need programs like what, Jim, you're talking about.
Well, you're so right, John. When we look at it, from a standpoint of being able to have actionable data from an agency standpoint, my heart goes out to an agency because they're responsible for an episode of 30, 45, 60 days. They've got to increase functionality. They've got to decrease readmissions. They've got to increase patient satisfaction, and they're responsible for somebody. But they're only there an hour and a half a week, 45 minutes. And the patient then is left to 166 hours in that week to their own demise. And the agency has no idea what's going on with that patient during those 166 hours. If they would put Seniors Home Services Health Platform into their plan of care, they would know which patients they have to be paying attention to. They would know if somebody is having too many trips to the bathroom one evening. They would know if somebody is not feeling well. They would know if somebody's not taking their meds. They would know if somebody is having whatever issue is taking place. And that's going to make all the difference in the world for their outcomes of improving functionality, reducing readmissions, and increasing patient satisfaction. They're going to watch their CAP scores skyrocket. They're going to watch their star ratings go up. They're going to watch their reimbursement rate go up.
How does with the Presario, where is the information coming? I mean, where is that information coming from to the PCP? It's not AI, correct? It's not artificial intelligence you're using.
It is. So with Pulsario, it's bringing in via YouTube, Bluetooth. It's bringing in data into the Pulsario cardiostine brains of the system. And then We have a interoperability and engaged platform that goes right into the physician's EMR. So it's a pop-up that they can have. So the physician is being notified which patients need attention. So instead of them having to look at, 500 patients that may be on the program, it tells them you need to pay attention to this one, and this is what you need to do. You need to pay attention to this one, and this is what you need to do. So it's saving them a huge amount of time in being able to manage patients. It's also reducing having to bring on additional staffing and those type of issues.
Right.
In the near future, that equipment in the home will be replaced with a little tiny thing called BioChest, which will automatically collect those different peripherals, feed them into the CardioStine system, and then be able to go ahead and tell the physician who to pay attention to and what needs to be done with them.
Who developed CardioStine?
CardioStine was developed by Dr. Kevin Corville. He is one of 1,300 advanced heart transplant specialist cardiologists in Louisiana. So there's only about 1,300 of these guys in the entire country. He is a wonderful, wonderful individual. They've spent 10 years with the development of the technology. Some of their engineers came out of the Enzo Ferrari company. I mean, they've got some smart people behind the entire process. But, Kevin did this because as a cardiologist, he said, there's nothing, that's just, it's so frustrating for me to be overloaded with patient referrals and then meeting the patient going, there was no need for you to be referred to me, and have to go through getting yourself to my office and then going through the process of seeing me, the billables taking place to CMS. This could have all been prevented. This would have been prevented if the primary GP had adequate information and guidance as to what needs to be happening. And, it's not the GP's fault. I mean, these are difficult patients to manage. They're the toughest patients to manage, and they're the most expensive patients for CMS. We're driving that cost down, and we're making it much easier for a physician to be able to have those patients managed correctly.
Well, I don't think a lot of folks realize how important this is going to be, not just for driving the cost down, but to improve their outcomes. With value-based purchasing, John just mentioned that we're going into our last quarter of the year. We're in the last quarter of data collection for CMS, for value-based purchasing. And I mean, this is real information that they're collecting. And so getting all the tools we can to improve our outcomes is going to be critical for the next quarter and also for next year. So I think this session today is really timely. It's going to give agencies information for how they can keep these people out of the hospital. I mean, falls is one thing, and falls certainly is the target that CMS had, but the lack of attention that we're paying to a lot of the OASIS items, cognitive. I can't stress to you how important those BIMS and CAMS assessments are to get done. And if you find things, Zing performance, let me give you a really good personal example. I have a family member who has a phobia about dentists. And every time she has to go somewhere, like a beauty shop, to have her hair washed, or get in a dental chair and has to go back in that dental chair, she panics and she has an anxiety attack, literally has an anxiety attack. Got her on Zing Performance. In 30 days, she was able to go to the hairdresser, lean back in that shampoo bowl and not have an anxiety attack. First time in years. It works. The Zing Performance absolutely works. I could give you other examples, and I won't take the time to do that, but I'm a huge advocate of Zing, and I have family members that have used it, and I know it works. And I hope that agencies will take advantage to talk to you about that. All of these tools that Jim has available at Senior Home Services is going to be an improvement in your outcomes. And again, that needs to be our focus from now and until forever. Home care, we're not going to get away from value-based purchasing. It's going to stay with us for the rest of our industry lives.
I wanted to just shout out to Tammy Kirby. She said this is a huge potential game changer and a very proactive way of healthcare for everyone's patients, families, providers, and agencies. Thank you, Tammy from LinkedIn. We've had a lot of comments today. Please, guys, as we're on here, you feel free to reach out in the comments. We'll show them. We'll be talking about it. I think at the end of the day, the patients also are embracing technology.
Yes.
10 years ago, and 5 years ago, maybe 3 years ago before COVID, it was seniors are never going to touch an iPhone. Seniors are never going to touch an Android. Now they're operating multiple devices. We're starting to see the adoption rate really exponentially increasing, which also I think ties all this together that says, yes, it is possible. We do not have to have the excuse that, seniors are not capable, but they're very capable and now they're willing.
Well, you're so right, John. The statistics show that over 77% of seniors are actively engaged in social media, actively engaged on a mobile device. And that is, that's the reason why we took and encapsulated all of our solutions into a great tablet phone platform where everything is right there for them to be able to use and have access to. And it's entertaining. It's going to keep them from being isolated. They're not. It's going to identify if we've got depression. They love technology, and the nice part about it is they can't break it. They can do whatever they want to do with it. And if they do have issues, and that we've got reps that will come to their home and be able to help them, get started and those type of things. It really is. We simply, as somebody put it a few months ago, they said, as we have our silver tsunami occurring, which is starting now, we simply do not have enough people to take care of the number of people that need to be taken care of. And the only thing that is going to bridge that is technology.
That's right.
And that's technology in the home, because we don't have enough places for them to go to be taken care of either.
Yeah.
So, keep them at home, treat them at home, and to keep them out of the hospital.
Yeah, keep them out of the hospital, and at home is going to be our lowest cost of care. It's only the most efficient thing to do, but I think it's what individuals want. People want to age in place at home.
That's
Most
right.
people do not have $4,000, $3,000 on average low end to $7,000 on the high end a month to have for assisted living costs. Or provider services 24/7. They didn't necessarily plan for it. Kim Fields on Facebook asked, will it work in very rural areas? Great question, Kim. Jim.
All of our technology, the entire platform works anywhere there is a cell phone connection or an internet connection.
Awesome.
Good questions.
Yeah, great question.
Yeah.
Well, Jim, thank you so much for coming on today. We're kind of getting up towards the end of or the top of the hour, and we've had a lot of great comments. We've had a lot of great people on today, a lot of listeners. Arlene, I think, like you said, when we were talking about this episode, this is such an important precedent that they're setting, and it's probably going to have more down the road. So this is just probably the first thing. And anybody that's listening to this, that's, on the cusp of should I get technology or not, we're trying to push you ahead to say, yes, start. It's not the technology. It's not the newest gadget. It's what tools are available to help you accomplish what is needed for these patients, for you to be able to expand your staff without stretching them beyond belief, because that's not fun.
Well, yeah, the impact we have with the shortage of staff, the increased number of patients, the sick patients that we're not getting patients that just need to have their blood pressure checked once a week. We're getting very, very sick patients, like the congestive heart failure patients. There's got to be a better way, and there is. And I'm hoping that the home care agencies and the clinicians and administrators, whoever's on this broadcast today, will share this information with their friends, because this is going to be a significant change in the way you do business and the way you care for your patients. Your patients are going to be happier. You're going to see improvement, like Jim said, in patient satisfaction scores, which is 30% of value-based purchasing. You're going to see an improvement in function if you put some of these programs in place. You're going to see a reduction in those hospitalizations and those emergency room visits. Do we have a couple sponsors that we wanted to thank for being part of our program today, John?
Absolutely. I know I'm going to say thank you to Gateway Coding. Thank you. We are really appreciative of all your support. Sorry, I need to queue up our slides. I normally have a little slide here. And then who is our other sponsor today?
Well, Senior Home Services is one of our sponsors.
Yeah, thanks, Jim.
Thank you, Jim. Thank you so much for being an active sponsor for us. And then Narcex. Yeah, Narcex is a product disposal system that every hospice in the United States should be using right now. We have a horrendous drug problem, and the drug problem also starts at home. Not just health starts at home, but the drug problem also starts at home. So another way that we can help avoid rehospitalizations with medication non-compliance and that type of thing. So we want to thank all of those sponsors for helping us be able to broadcast this, hopefully weekly. We're
getting good. We're getting there. We're getting that train rolling.
Somebody does have a question about the Medicare reimbursement.
Rosalinda Ramirez on Facebook asked, is there Medicare reimbursement?
Absolutely. And we manage all of that. So we take care of the entire reimbursement process. But there is no cost to an agency. There is no cost to the patient, no cost to the family. I try to tell agencies, if you partner with Seniors Home Services, you're expanding your staffing without any expense whatsoever, without having to manage staffing or anything. Our care consultants, when they meet with patients to go ahead and do the onboarding of our tablet platform onto their phone or their tablet, it's free. It's not costing them anything at all. And the outcomes that they'll have are just going to be spectacular.
Perfect.
Awesome. Okay. Well, thank you so much, Jim, for coming on today. I think we really did get to cover a lot. Please, guys, feel free to reach out to us in the comments. Jim's phone number is there at the bottom, 800-480-3344. Jim, what's the website?
www.seniorshomeservices.com. That's seniorshomeservices.com. There's a little form anyone can fill out on there if they want us to contact them to be able to go over our solutions and how we can make a big difference in your outcomes.
Make sure you put an S at the end of seniors. I forgot to do that. And I a lot of other things, so make sure you put the S at the end of seniors.
And our 800 line is answered 365 days a year, 24/7. So feel free to call us at any time.
Wonderful.
Okay. Thank you.
Well, everybody, thank you so much. Like Arlene said, we're going to be trying to do this weekly on Wednesdays at 12:03. Just think OTC at 12:03. And again, I'm John Kublank. Thank you so much, Arlene, for joining us today.
Of course.
And thank you, Jim.
Pleasure, guys.
Appreciate it. Until next time, guys. Thanks. Bye.
Bye-bye.